I'm Miles Price and I'm from Life Clinic, and today we're going to be talking about conventional medicine and functional medicine. Conventional medicine is an approach which has started since post-war period, and conventional medicine is very much an approach used for treating symptoms of disease and very much a drug-based approach. What we find conventional medicine is very effective for is actually treating infections like viruses, bacterial or fungal infections, and we have a series of drugs which are antibacterial or antiviral, for example. Also, conventional medicine is very effective in emergency situations. When you've had an accident or when you've had trauma, we need to go to ER and be fixed. The trouble is with conventional medicine is that it has some shortcomings in treating chronic diseases like cardiovascular disease, hypertension, cancer, diabetes, for example. What happens in these conditions is when we give drugs to help those diseases, they're only suppressing the symptoms and they're never actually curing the disease. So what we find is that we need to take another approach to helping those patients with those conditions so we can help them reverse their diseases. And this is where functional medicine comes forwards. Functional medicine was developed in 1991. It was developed by a group of doctors who came together who realized that the conventional medicine model was not supporting the healthcare of their patients. What they devised was a systems-based approach to treating disease and treating the causes and triggers of disease. And what they found was that when you treat the whole body, and when you treat the whole body with natural substances to address the condition, we can find that we can reverse the condition that patient has. So for example, we use things like dietary change, supplements, detoxification, lifestyle modifications, and these integrated together can actually have much more profound impacts of chronic diseases like diabetes, cancer, heart disease, and autoimmune disease. So we find that using functional medicine tests can actually help us understand what's going on in the body, whether or not there's a heavy metal toxicity or hormonal imbalance or gut-based infection, which can actually contribute to these conditions which patients are experiencing. So let me give you an example. If you have a patient with eczema, in conventional medicine, we give that patient a steroid cream. That steroid cream will help suppress the symptoms of eczema. But when you stop taking that cream, the eczema will come back. In functional medicine, what we do, we look at why that eczema started in the first place. We look at deficiencies which may be contributing to poor skin health. We look at the way the gut is affecting the skin, because there's a direct connection. And looking at all these other factors, we can address the root cause of why the eczema started in the first place. So we do this approach with many other conditions and diseases. And by taking that approach, we can actually help the health of the patient for long term. So that was the basic introduction to the conventional medicine and functional medicine approach. And at Life Clinic, we provide them together to give the patients the best care. Thank you very much.